Thank you everyone for joining us for the second edition of Go Red Goes Virtual. We're so excited to have you here with us today. For the best experience today, you'll want to click the top right-hand corner to go into speaker view. If you're having any issues, please just send us a note in chat box and Dina will walk you through that. We hope that you enjoyed our virtual tribute wall. Today, we wanted to come together to celebrate the special women in our lives, including you. Now, Go Red for Women is all about empowering women to take control of their own health. So for these next 45 minutes, we want you to forget about any of the stresses going on in your life, anything else that you have to do today, and just focus on yourself. Focus on your mental and physical well-being. We have a great lineup of panelists today to help you do that. In just a moment, you are going to hear from our Executive Director, Jennifer Davis. And then after that, we have a very special guest, Chinwe Onreiki from Mainline Health. She was actually our 2019 Go Red for Women co-chair. And she's going to be sharing some really important information about the incredible things that we are doing here locally in Greater Philadelphia to address health disparities and COVID-19. In addition to Chinwe, we are going to get up and get moving with Twitch and Allison. So be sure to get ready to get up as soon as they come on in a few moments here. We also have Barbara Catania from Mainline Health with us today. She's going to lead us through some mindfulness and meditation activities. I can't wait for that. And finally, Pat Nogar from Living Well with Pat Nogar is here with us today. And she's going to share some tips and tricks with us on how we can make our Mother's Day weekend extra special for the women we love, whether we're celebrating with them virtually or in person. You know, it also be something special for you. So throughout today's event, your mics are going to be muted, but as I said before, we do have the chat box open. So please share your comments with us, questions. We'll get back to you throughout today's event as soon as we can. And remember that we will be sending you a digital resource guide after today. So it'll include everything that we've talked about in addition to a bunch of other resources that are going to be really helpful for you. So before I turn it over to Jennifer Davis, I do want to thank all of our sponsors who are making things like today possible for us. I want to especially thank our national sponsor, CVS, our City Goes Red sponsor, Mainline Health, and our platinum sponsor, AmerisourceBergen. Thank you all so much. Now, before I turn it over to Jennifer Davis, we want to share a very inspirational video with you today in honor of Mother's Day and National Women's Health Week. Thank you.
She's my person. Her favorite phrase to say is, Sydney's my best friend. I want to be for my daughter what my mom has been for me.
My mother is very generous, to the point where she just leaves nothing for herself.
After my dad passed away, I've never once felt like I was missing something.
I aspire to just be a portion of who she is. She's my superhero.
I worry about her health all the time.
Recently, I've been feeling like it is more necessary for me to really help her out more than before. My family has definitely had heart issues.
I have a very large history of heart issues in my family.
My mom has had 4 brothers. Now she only has 1 because 3 of her brothers passed away from heart attacks.
When my grandmother passed, it was unexpected. She seemed fine.
I don't want her to go early like everybody else did.
Honestly, I don't think I want to imagine a world without her.
That's a sucky world to think about, not having that person that you call on all the time.
I just want her to live the longest life she can live an amazing life.
She's always been that person to take care of everyone else. I want her to take care of herself. That's the big thing.
My mom is more health conscious because of me.
I absolutely think she looks at me for as like a model for health.
When we talk on the phone, I'm always like, hey, I just came from the gym. What did you call me for again? Like, she sees my daily routines.
We both just joined gyms. So that's step one.
You need a partner. You need a buddy. So I was her buddy.
I've seen my mom transform when exercise was brought into her life. That's definitely something she's modeled after watching me.
I would like my mom to be there for when I have children, to be the grandmother.
I love her and I want her to be around for a very long time.
I tell my mom all the time how much I love her and that I need her.
I love her so much, and I'm so grateful for the person that she's always been to me.
Thank you for everything and making me strong.
She's a fighter. Yeah, like nothing can get in her way.
To me, she seems invincible, and I just want her to be able to live like there's no tomorrow.
Mom, watch me.
Watch me.
Mom, 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 watch me.
Wow. That video gets me every time. Welcome, everyone. It's great to see so many new and familiar faces on the call today. Cardiovascular disease is the leading cause of death for women, taking one woman's life every 80 seconds. That's more than all forms of cancer combined. And it's on the rise, impacting younger generations of women. Although cardiovascular disease is largely preventable, 1 in 3 women live with heart disease and stroke. That's 1/3 of our mothers, sisters, and friends. It is so important that we change this fact, yet disparities in care for women continues to exist. Cardiovascular disease does not discriminate. It affects women of all ages, races, and backgrounds, yet women continue to be overlooked. Symptoms are dismissed, and we are omitted from life-saving research studies that need to treat, beat, and prevent heart disease and stroke. The time is now that we come together to demand better when it comes to our health. As the chief health officers of our homes, we must harness our strength to take a stand for our own health and to inspire our loved ones around us to do the same. We must demand to be counted, equally represented, and treated fairly when it comes to cardiovascular care. During this COVID-19 pandemic, we are learning that so many people are prolonging their emergency room visits in order to stay out of the hospital. It is very important for us to listen to our bodies and know the signs and symptoms of heart disease and heart attacks more than ever. We must continue to use our 911 services even during this time. My hope for our time together today is that you will be inspired to be an agent of change for women and to be a relentless force for a world of longer, healthier lives. Today, I am also asking you to consider making a gift of any amount to help our mission move forward. We encourage you to make this gift in honor or in memory of your mother or the special women in your life. While we may not be able to stand physically together with our mother on Mother's Day due to these unprecedented times, we will always stand with them emotionally, just as they have always stood by us. You can make a gift through our Text to Give platform by texting Philly Go Red, that's PHILLYGRFW, to 41444. You can see that up on your screen. As we look forward to celebrating Mother's Day on Sunday, we want to help you honor your mother and all the influential women in your lives who have watched over us from the very beginning. Our moms have watched us with pride, love, and with admiration, and they continue to watch us as we've grown into the smart, thoughtful women we are today. So the best thing that you can do for yourself and for her is to actively take small steps that add up to a healthy heart. One of those most basic components of living a long, healthy life is to stay active. So today we are going to move more together. From the Ellen DeGeneres Show, Twitch and Allison have teamed up with the American Heart Association to lead a virtual living room friendly dance party. So that's exactly what we're going to do. So to kickstart our program, lace up your shoes and let's get started with Twitch and Allison.
Here we go. Let's bring it back to that two-step. Let's go. Ah.
You can see we get a little bit bigger with it. Hey, hey.
Two to each side. Let's go. Two-step. Let's go.
All right, what we're gonna do next is 2 forward and 2 back. Let's go. Hey, step, and back. Hey, hey, hey.
Let's keep that going. And I'm going to show you the variations. We just open it up. Hey. Hey.
Now we take our arms up. And down. Let's go. And then on. Hey, 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 hey.
Keep it going. Keep it going. Hey. Bring it back to the two-step. Let's go. Hey, hey, hey. And you know what? Let's go ahead and get this head involved. Let's go. Look and look and look and look and look and look and look. Let's bring it down to the shoulders. We go shoulder, shoulder,
Nice.
shoulder, 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 shoulder. Now we're just gonna go a little faster. Shoulder, shoulder, shoulder.
Hey.
Now don't let these arms fool you. Our shoulders are basically doing this, right? Just loosen the arms up. Hey.
Let's go. Single, single, double. Let's go. Single, single, double. Hey, hey. Oh.
Let's bring it down to those hips. Roll them around.
Oh, oh.
Hey, other side. Let's go. Ow, 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 ow. Now we hit the hips like this. We go. Now here's the variation. If you're doing upper body, give me the rock.
If you want to get a little bit bigger, get a little bit lower.
Hey.
Hey, huh. Hey.
And if you rock the upper body,
Hey.
just a little bigger. 2 up, 2 back. Let's go. 2 up, 2 back. 2 up, 2 back. 2 up, 2 back. 2 up, 2 back. Look, I'm rocking, I'm down. I'm rocking, I'm down. Hey, 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 hey. Bring it back to the two-step. Let's go. Oh, hey.
You guys are doing so
hey,
good.
Hey.
So good. You're almost there. Hey.
2 to each side.
Hey.
Let's go. Now we got 4 walks to the front, 4 walks to the back. Walk
Let's
front.
go.
1, 2, 3, down. Hey. Bah. Hey. Ah. Hey. Ah. 2 step, 2 step. Come on. Ah.
So good.
Hey.
Keep it going. Hey.
Let's go, let's go.
Hey.
Bring it down, bring it down. Bring it down. Bring it
We'll
down.
stop it.
Bring it down. Hey.
Oh, right in that pay down.
This is a very
That was so fun and energizing. Thank you. With the coronavirus pandemic changing many of our daily routines, it is so important to remember to sit less and move more. My name is Chinwe Onekri, and I'm the System Director for Health Equity and Graduate Medical Education at Mainline Health. I had the pleasure of serving as the 2019 Go Red for Women co-chair and was so impressed by the work that the American Heart Association and Go Red for Women is doing to address disparities in care and research focused on women's heart health. I am also proud to participate on AHA's Social Impact Committee here in Philadelphia. This is a dynamic group of experts in health equity and health disparities that helps to shape and guide the local efforts of AHA in under-resourced neighborhoods in Philadelphia. People living in under-resourced communities, particularly African Americans and Hispanics, are dying of COVID-19 at disproportionately high rates, as they are more likely to have underlying health conditions such as high blood pressure, diabetes, heart disease, and obesity, and are more likely to work frontline jobs, limiting their ability to socially distance themselves, and are less likely to have access to quality health care. Long before the pandemic, systemic challenges have contributed to disparities that impede some people from living long, healthy lives. Under-resourced communities have a higher risk of developing heart disease, the #1 killer of all Americans. African Americans and Hispanics are more likely to live with diabetes compared to non-Hispanic whites. Your zip code shouldn't determine how long you live, but it does. Life expectancy can differ by as much as 20 years for people living just 5 miles apart. As a public health practitioner, addressing these inequities has been a lifelong mission of mine. Here at Mainline Health, we are working on this issue in a number of ways. The Medical Student Advocate Program leverages the time and talent of Philadelphia College of Osteopathic Medicine's second-year medical students to identify and address social needs like food access, childcare, housing, and employment. The Deaver Health Education Center at Lankenau Medical Center delivers innovative free programming to over 7,500 to 10,000 youth annually on issues related to healthy living, physical activity in a dynamic and interactive classroom. And the Deaver Wellness Farm, a half-acre farm right on the campus of Lankenau Medical Center, has produced over 19,000 pounds of food and integrates this hyper-local organic food directly into how we deliver healthcare. The need for these programs have been exacerbated with COVID-19, and we have worked quickly to respond. The medical student advocates have continued to do outreach to our patients via telehealth visits. The Deaver Health Education Center has created virtual programming for our schools and youth programming. And the Deaver Wellness Farm is proud to partner with MANNA to deliver hyperlocal food from the Deaver Farm directly to our patients' homes. The AHA is also responding to COVID-19 pandemic and its impact on communities of color by addressing gaps in access to care and access to healthy food that have been exacerbated during this time, and are continuing their focus on priority populations in North and West Philadelphia. AHA is a proud member of Together for West Philadelphia. Together for West Philadelphia, incubated at Mainline Health, is a collaborative of more than 20 organizations in West Philadelphia community dedicated to maximizing impact in the areas of health, education, food access, and opportunity. Together for West Philadelphia accelerated the implementation of our Helping Hubs project to meet the need of our community during the COVID-19 pandemic. Through this project, residents can connect to resources like nutritious food, housing, childcare, and preventative healthcare services. AHA facilitated connecting Together for West Philadelphia with one of their partners, the Allen Locke School, an elementary school, K-8, that is located in one of their priority populations, the Belmont area of West Philadelphia. We are so excited to be launching the Helping Hubs program this week. In relation to access to care, as an added layer to AHA ongoing work with federally qualified health centers who serve underinsured and uninsured patients, the AHA has supported a number of health centers in their transition to telehealth appointments for high-risk, hypertensive patients by providing home health kits to distribute to patients. These health kits are either being delivered to patients or provided during appointments that are deemed medically necessary, to include blood pressure cuffs for at-home monitoring and a home health management educational packet with information on how to self-monitor blood pressure, along with AHA health and well-being education. This is such important and timely work. I'd like to take a moment to recognize and thank Andrea and Ken Frazier, who are longtime AHA supporters and the President's Circle Corvite Society members. Andrea and Ken have provided critical support for our Go Red for Women and Heartball campaigns. Through their overarching partnership, they have helped to design and fund some of our most innovative local community impact programming, including those that I just mentioned. Thank you so much for your leadership and for your generosity. You make our work at AHA possible. The AHA has also facilitated approximately 2,400 pounds of food delivery to a shelter in Southwest Philadelphia and is working alongside an urban farm in North Philadelphia to provide produce deliveries to 50 North Philadelphia families. With the help of supporters like you, this local work will continue to grow and evolve over time. To further support the work, please consider making a gift by texting Philly GRFW, Philly Go Red for Women, to 41444. Every single dollar counts and will make an impact. It is now my pleasure to turn it over to Pat Nogar, who will be showing us different things that we can do to celebrate our mother and the special women in our lives for Mother's Day.
Thank you, Chinwe. I appreciate you sharing that incredibly important information with us. I also appreciate the work that the American Heart Association and Lincoln are doing to address these health disparities in Greater Philadelphia. I'm Pat Nogar of Living Well with Pat Nogar, and I'd like to thank the American Heart Association for inviting me to join you this day as we celebrate mothers. The table is a powerful place. As we grew up with our families, it's where we gathered to eat meals, usually prepared by our mothers, to tell the stories of our day and how it went. It was really where memories were made. So it stands to reason that one of the ways we want to honor mothers is to create a beautiful table at which to dine with her, to show her how much we appreciate her. A beautiful table conveys a message of caring and love, but it doesn't have to be difficult. One of the first pieces of advice that I give is start with what you have. A table setting should be personal. Look around the house and see what you have. Usually it's something that came from your mother or your grandmother or your aunt. Oftentimes it's a gift from a beloved friend that you want to put on your table because it makes that table personal to you and to the people that you will be serving. It says that I'm sharing a part of myself with you. The next piece of advice I give really is fourfold. There are 4 elements to making a table beautiful. The first one is to select a theme. What do you want your table to say? And in this case, we wanted to say Happy Mother's Day. So we want the table to be cheerful, to be bright, and to really make mothers feel embraced when they sit down. The next thing we want to do is say, what color do we want to use? For me, my mother's favorite color was blue. So my table today, as you can see, is really predominantly blue. I've also made it very personal. Remember I said make it personal, to find those things that belong to you or to your mother or grandmother. I'm actually using the china that belonged to my grandmother. I'm also using the flatware that belonged to my mother. So this table is incredibly personal. I didn't have to run out and buy anything at all. And I'm betting that most of you are in the same position, that you can look around your house and find those things that you love and that you've used. As I say, they're well-worn, well-used, well-loved. You can find those things and build your table around them. So now you've got your theme, you've got your color. Texture is very, very important also. If you look at the design on the table, on the china, that's your texture. Texture can also be found in the lace of a tablecloth. It can be found in a loose weave. It can be found in a lot of things on your table. In this case, my most favorite texture is the silver overlay on my grandmother's glasses. That brings a pop to the table. It's not flat, it's not plain. So you want to make sure you're adding some texture. It could be a plaid napkin. That counts as texture. So you want to do something to sort of pump it up, or as they say, give it a pop. The last thing is my favorite thing, and that's bling. You want to add some shine to the table. You want to make sure there's a little bit of gleam. And I've got a lot of gleam on this table, in addition to color and texture. The gleam is found again in the silver overlay on the blue cobalt glasses. It's also found in my flatware. It's found in the silverware. It's found in the crystal that's on the table. There's a lot of bling on this table. It's not overpowering. It's just enough to say, this is not an everyday table. This is kind of a special table because after all, it's Mother's Day. What do you want to think about next when you think about creating a beautiful table? Flowers. Flowers are the perfect touch to a table. And in this case, I didn't have to look far. I had fresh flowers delivered to me a week ago from an organization as a thank you. And I've enjoyed them. I change the water in them every day to make sure that they live for a very long time. And here we are, actually a week and a half, almost 2 weeks later, and the flowers are just as fresh as they can be, and they fit in perfectly on today's table. So I'm using something that I already have. But you know what? You can also run to the grocery store. If there's one, if you're doing a grocery run, you know, we don't do grocery runs carelessly today, but in your Instacart or on one of your trips to the grocery store, you can purchase flowers. They're very affordable at the grocery store. Farmers markets are a great source for flowers. And if you're a gardener, you can cut them from your backyard and put them in a vase and put them on the table. In fact, that brings me to our project, our flower project for today. Flowers can be presented on a table in so many ways, and one of my favorite ways to do it is this one. This is a very personal floral arranging, and I use this a lot on tables, and people always respond really well to it because it's one that's made just for them. This is an egg cup. You know where you put a soft-boiled egg in for breakfast? Take the egg cup, fill it with flowers, and in this case, spray roses from my yard, but you can also get spray roses from the grocery store, from the farmer's market. If your neighbor's not looking, you can get them from your neighbor's yard. But tuck them into the egg cup. You can also use one large bloom. That works just as well and is actually a lot easier. In this case, I use small spray roses. So each person, as you can see, around the table has their own little floral arrangement. And you know what? Egg cups are what? $2 a piece? They can actually take them home with them at the end of the meal. So everybody has a little treat to take home. I love sending treats home with people from the table. It serves as a reminder of what a great time they had and how special you felt they were when you welcome them into your home. Food, of course, is the big part of the table, of a tablescape, because no tablescape is complete without food. For that, I want to make sure that mothers are eating healthy today. Of course, we want our mothers to be well. So instead of, you know, just sort of creating something that was particularly special, which might have been fattening, I went straight to the American Heart Association's website. And they have a ton of fabulous recipes there that are not only healthy, they are delicious. The first thing I found was this, and it's a pineapple upside down cake. Who would have thought a pineapple upside down cake could be healthy? but it is, and it's right there on the website of the American Heart Association. So give it a try. Your mother will love this, I promise. I tested it on my husband and he loved it. The other recipe, which I thought was particularly special for Mother's Day, is the raspberry basil iced tea. It's made with iced tea bags, fresh basil, fresh raspberries, really quick, really simple, but it looks beautiful on the table. Now, how do you include mom in this? Mom may not be living with you in the middle of this pandemic when we're all sort of confined to our homes. If you're lucky, she is, but oftentimes she's not. There's some things you can do. We can interact with them, obviously, through social media, Facebook and Zoom and other platforms, but you can also have a meal delivered to your mom's house to make sure that she's having something special that day. Or you can buy her a gift certificate card and send it to her from her favorite restaurant. She can then call and order what she wants. But how do you want to make it extra special? You can literally take a place setting, box it, drop it off at your mom's front door. Social distancing, of course. Leave it there with fresh flowers. It's the same place setting that you'll be using on Mother's Day. And on that day, as she enjoys a beautiful meal you sent, you guys will be eating from the same place settings. What a way to bond on Mother's Day and to make sure that your mother doesn't feel isolated. Including mom is the best thing that we can do. Thank you so much for having me today. It's been a pleasure being with you. I wish you all a safe and enjoyable Mother's Day. I hope that I've given you some tips to make it even more special. I hope that you'll be able to spend Mother's Day with those that you love. Now back to Twitch and Allison to get us up and moving again.
All right, we're gonna treat this as a cool down, so please stay in the groove. Let's get with this two-step. Let's go. Oh. East side, let's go. Hey. Hey.
Hey, do we keep breathing? Let's go. Hey. Hey. You feel that good right now, man?
Hey. Let's go.
Let's get that viral. Viral down. Hey. Hey. Oh. Other side. Let's go. Hey. Hey. Oh.
Keep it going. I got you with the variation too. Other side, come on. Hey. Back to the two-step, come on. Woo. Make sure you're breathing during this. Hey, let's go. Now what we're gonna do is we're gonna bring it back to that move that the Temptations made so wildly popular. It's been perfect like this. Look.
Hey.
Friday night is the name of this song. Get your crew to the club and get your groove on. And you know what I want you to do? Just keep this going. But if there's somebody in the room watching you right now, just go ahead and point them out and say you're missing out. You're missing out right now. Even if it's a pet, point at the dog. Say you're missing out right now. Let's go. Two-step it back. Let's go. Hey.
All right. We're gonna get into that grapevine. You ready? Here we go. Grapevine it out. Let's go. Hey. Woo. Hey. Keep that going. Oh. Hey.
Now, while we keep this going, here's the variation. Look.
Oh. Yeah, you guys have been so amazing. Woo.
Hey. 4 bumps to the front and 4 to the back. Treat these cool though. Get your groove to the club and get your groove on. 2 more times. Get your groove to the club and get your groove on. Hey, step it out. Got a little fake action going on. I like it. That feels good. Let's go.
You know what I do?
Let's go.
I want to say thank you to all of you guys.
Yo.
Wow.
Thank y'all so much. This was such a good time.
I love those moves, and what a great way to stay energized throughout the day. Hi, everyone. I'm Barb Catania from Women's Emotional Wellness Center through Mainline Health. I'm a licensed professional counselor and certified yoga instructor, and I'm trained in mindfulness-based stress reduction techniques. I'm so happy to be here with you today. And as we all know, public health issues can cause a lot of stress. There's really no way around that, but there are some simple ways that we can reduce our stress. And remember, when we reduce our stress, we improve our overall health. So I invite you to join me in a mindfulness meditation practice right here, right now, where we will focus on deep breathing and a body scan to try and quiet the mind and relax the body. And hopefully, it will help you to decrease some stress. So go ahead and find a comfortable seated position. And when you have found your comfortable seated position, just pay attention to the spine here, making sure that the spine is lengthening up to the ceiling and that the shoulders are dropping down toward the floor. That helps us to open the belly for deep breath. Resting the hands on the lap or on the knees, whatever is most comfortable for you. Feeling the feet planted on the floor. And then focusing on the eyes, whether you want to close the eyes altogether or just focus the eyes on the floor a couple of feet in front of you. That helps to soften the eyelids. And from here, take a nice deep breath into the belly. We're going to start by focusing our attention on the belly, inhaling through the nose if you can, feeling the belly expanding out as you breathe in, breathing out the nose or the mouth, feeling the belly falling back into place as you breathe out. Taking some deep breaths here into the belly. Sometimes it helps to count the breath if the mind is having trouble focusing on the present moment. Inhaling for a count of 4. Exhaling for a count of 4. We're going to keep that breath going as we focus our attention on the face and in particular our jaw. Separating lips and teeth about 1 inch or 2 helps to naturally release tension in the jaw. Oftentimes we carry tension here, grinding the teeth or clenching the teeth without even realizing that we are doing it. So taking a moment to check in with the jaw is helpful. Resting the tongue on the bottom of the mouth. And continuing to breathe deep into the belly as we move down the neck and shoulders. Imagining the shoulder blades melting into the upper back, shoulders dropping down toward the floor. Starting to feel the breath getting deeper and slower as we move into the arms, hands, and fingers. And moving down into the spine, through the chest and belly, into the lower back, relaxing the muscles, feeling the belly rise and fall with the inhale and exhale. And then bringing your attention to the hips and the pelvis, feeling the support of the chair underneath of you. Feeling the body relaxing as we come into the legs, all the way down the legs, into the ankles, into the feet and the toes, maybe wiggling the toes for a moment. And then bringing your attention anywhere else in the body where you tend to carry some tension or feel some tightness. Taking a moment to relax those muscles. And maybe noticing where the mind is, if it's drifted or wandered away from the present moment, just gently guiding it back to the breath. Taking a few more rounds of deep breaths into the belly. Noticing how the mind and the body are feeling in this moment. Knowing that you can practice deep breathing and body scanning techniques anywhere at any time. Taking even just a couple of minutes out of your day to focus the mind, to relax the body. Taking one more deep breath. And at your own pace, if the eyes are closed, gently opening them, coming back into the space. I hope you enjoyed taking this journey with me. Please keep an eye out for additional mindfulness resources through the American Heart Association and a full list of services that are offered at Mainline Health's Women's Emotional Wellness Center after the event.
Well, thank you, Barbara. I feel already much more relaxed and calm. So thank you so much. And thank you to Pat and Chinwe for being with us as well today. And thank you to each of you for taking time out of your busy schedule to be here with us. You were all invited today because you have contributed to the mission of the American Heart Association in one way or another. And it is because of our long time and committed partners that we have been able to play a role in being part of the solution right now in this COVID-19 pandemic, but for the future. So thank you. Thank you to our sponsors and thank you to our loyal donors. If you are financially able to support and do want to make a difference, again, we remind you to use our Text to Give platform. That's Text to Give. It's Philly GRFW 41444. I want to thank so many of you on the call today who have already made a difference. We've been humbled and grateful for all of the generous support. So thank you so much. Please be on the lookout and mark your calendars for June 11th at 12 p.m., which is the virtual Go Red for Women luncheon. So we hope that you'll be able to join us there. If you do have a few minutes to hang out and watch our virtual tribute wall, please do. Otherwise, thank you so much for being here today and be well.